Next question comes from India TV, independent news service, and we have with us Siddhant Mamtani. Can you hear us?
Hello?
Yes, please.
Am I audible?
Yes, we can hear you.
Good evening, everyone. Dr. Tedros, my question is basically a two-part question. India has become the 11th country in the world to cross 100,000 COVID-19 cases. So how do you see this graph going forward? And do you think the measures that are taken in India are adequate? And part two is basically on research and trials of vaccine that is going on around the world. We've seen that the process has been fast-tracked in the recent times, looking at the rising number of cases. Do you think that this accelerated timeline for manufacturing of drug or vaccine is safe, given that normal timelines in such situations is far longer? So how do we eliminate that the long-term side effects are not there?
Siddhant, just you are new to us, but we always stress that we have one question per journalist. Thank you.
All right.
Just I will begin, and Maria will come in, I think, on the timelines on vaccines and other issues. First of all, our thoughts are with people in northeastern India and in Bangladesh as you face the potential impact of a hurricane, or the cyclone, sorry, Amphan. And we know that the Bangladeshi and the Indian authorities are making some quite incredible preparations for the arrival of that huge storm, and we trust that everyone can be kept as safe as possible. Well, with regard to the epidemic itself, India continues to do a very good job in combating the epidemic and trying to manage and balance controlling COVID-19 with the economic and social consequences of that. It's still early for India, as it is for many countries in South Asia. We continue to provide operational, technical and scientific support to India from our regional office, which is actually based in Delhi under the leadership of Poonam Singh, our regional director. And we will, as I said, also rely on India. India has a massive capacity for vaccine production as well. India is not a net beneficiary of vaccines. India produces vaccines, high-quality vaccines that are delivered all over the world, and as such has some superb companies, both in the public and the private sector, that are working already with WHO on developing vaccination solutions. So we look forward to that continued partnership with India, both in the public and the private sector. And Maria can take you through some of the issues regarding the timelines on vaccine. WHO, just to remind everybody, there are no shortcuts here. There are things we can do faster and better. There are things we can do in parallel. But there are no shortcuts on safety. There are no shortcuts on efficacy. It's really, really important that when we say we wish to go faster, we wish to be as efficient as possible, but still complete every step that's necessary in delivering a safe and efficacious vaccine. Maria?
Thanks, Mike. So yes, absolutely. There's a number of things that the WHO is doing to support the development of vaccines around the areas of global collaboration and coordination, making sure that the methods that are being used to evaluate and develop these vaccines are robust, they're strong, they're scientifically sound, they're ethically sound, and working to collaborate, to bring together the different partners of scientists and public health professionals and leaders and manufacturers to accelerate not only their development, but ensure that when we do have vaccines, that there is equitable access to this vaccine. We are currently mapping the vaccine candidates that are underway, that are in development. There's more than 120 vaccine candidates, and I'm sure there's far more than even we're mapping. Some of these are in clinical evaluation, which means they're being tested in people, and some are in preclinical evaluation. I do want to mention that for some vaccine candidates, we had a bit of a head start in the sense that many of these candidates started their development prior to the emergence of COVID-19. And they began with SARS, and they began with MERS. And so some of them are a little bit further along. But it's important that as these vaccines are developed, we ensure that they fit and they meet all of the criteria to be safe and effective. As Mike said, there is absolutely no shortcut to that. So when we say accelerate the development, we mean accelerate this because there's a really urgent need, but that does not mean that we will skip any steps, that anyone will be allowed to skip any steps to ensure that we have a safe and effective vaccine. But again, it's not only having a safe and effective vaccine, it's ensuring that we have the production capacity in place, we have the systems and country in place, so when we do have this, we will be able to actually deliver this at the population, at the people level, to people who want this vaccine.